You know, when I was invited to come here tonight, I didn't realize I was going to be coming to the most important state when it comes to healthcare reform. But I obviously had, and delighted to be here. You know, when I was invited to come to Little Rock to share my insights into the healthcare system and what's going on in Washington, the raging debate about how to reform our healthcare system, it was actually, I think, around Halloween. And there was something pretty appropriate about the timing of that, because when you stop to consider what Congress has been doing over the past several months, it's downright frightening to realize that what Congress finally does to fix the system might ultimately do more harm than good. You know, at different times during this debate, I've really been worried that might happen, but I'm still a little worried to tell you the truth, but I'm an optimist, so I think that we may get some good reform this time. As I was thinking about Halloween, I remember the words that came to Dr. Frankenstein when he got the first look at his creation. "I beheld the wretch," he said, "the monster whom I had created." Today we can look at our healthcare system much the same way. A monster, dangerous, out of control, a creature of our own making. And like Dr. Frankenstein's monster, our monster is a product of good intentions. Yet it has the very real potential to do great harm. Actually, to say that we have a system at all is a bit of a stretch. Unlike most other developed countries that took deliberate actions to create systems that they have today, ours just developed more or less on its own. I won't go into a lot of detail about the beginning of our healthcare system in this country, or health insurance in particular, except to say that at its genesis, it looked very different from what it looks like today. In fact, many folks who are so opposed to reform would be surprised to learn that our original system of insurance was a much more socialistic approach to covering Americans than what we have now, which is frankly a profit-driven system controlled by Wall Street. The early Blue Cross plans came into existence in the 1930s, and although they were private entities, they pledged themselves to a public purpose. Among other things, they based their premiums on a community rate, and they provided coverage to anybody who agreed to pay the premiums. They did not deny coverage to anyone because of a pre-existing condition, or gouge people as they got older or because of their gender. Fast forward to today, and you find a system that has drifted far from the original mission and structure of those first Blue Cross plans. What went wrong? What happened along the way? Well, in a word, greed happened. For-profit companies and their Wall Street investors realized that they could make a lot of money by getting involved in healthcare, and health insurance in particular. While we still have a number of nonprofit Blue Cross plans in this country, they are an endangered species. We've seen so much consolidation in the industry. In fact, I'm going to have you think that I have been joined up here by 3 con artists, and they all have names. One is conversion, one is consolidation, and one is concentration. And I'll explain that to you. First is conversion. Over the last 20 years, roughly the time that I spent in the insurance industry, many of the insurance companies had been nonprofits that they converted to for-profit status. Today, many of the biggest Blue Cross plans in the country, from California to Maine, operate on a for-profit basis. Then came con artist number 2, consolidation. Since 1993, we have seen a remarkable series of mergers and acquisition, to the point that today the insurance industry is dominated by 7 very large for-profit insurance companies: WellPoint, United, Aetna, Cigna, Humana, Health Net, and Coventry. I call these 7 companies a cartel because they've become so big and so dominant. 1 out of every 3 Americans with health care coverage today is enrolled in a plan owned and managed by one of those 7 giant companies. And when you exclude Medicare and Medicaid beneficiaries, the ratio is 1 out of every 2. Finally, con artist number 3 is concentration. In every market in this country, 1, 2, or 3 big companies dominate, which means that for the most part, we really have only the illusion of choice of insurance companies. Here in Little Rock, Arkansas Blue Cross and Blue Shield has a 77% market share. In fact, that Blue Cross plan dominates every market in the state, ranging from 63% in Hot Springs to 97% in Texarkana. So what have been some of the consequences of a healthcare system that started out like Frankenstein and came to be controlled by Wall Street? Well, here are some vital statistics. We in the United States spend more than 16% of our gross domestic product on healthcare, far more than any other country on the planet. But we are kidding ourselves if we think that all that money is buying us the best healthcare. And here's some of the evidence of that. The United States ranks 37th out of 191 countries in rankings of the World Health Organization of overall performance in the delivery of healthcare. France and Italy came in first and second. In the fairness section of the World Health Organization's rankings, that is, whether the best care was available equally in a country, the United States ranked 54th, behind Bangladesh. A recent study of access to medical care in 23 developed countries ranked the United States dead last at number 23. Japan was first. In the section of that study on the number of deaths due to surgical or medical mishaps, the United States was first. This is where we were first, with more deaths per capita than any other wealthy nation. On avoidable mortality, the United States ranked 15th. And the United States, with nearly 7 deaths per 1,000 births, ranked 10th in infant mortality. In life expectancy at birth, the United States ranked 47th in the world, behind Bosnia. In another study, this one by Harvard, the number of bankruptcies attributed to medical bills each year in the United States has risen to 700,000. The total in France is 0. In Italy, it is 0. In Germany, it is 0. In Japan, it is 0. In Canada, we've probably seen some pattern here. If you guessed 0, you guessed right. The biggest reason for this is that nearly 50 million of us, more than the entire population of Canada, are now uninsured. And another 25 million of us are underinsured. And here's one final statistic that helps explain why we're not getting a good return on what we spend in this country on health care. The average administrative cost, including profit, of American health insurance companies is about 20%, and that's according to the Wall Street Journal. When you add in the administrative expenses at the doctor and hospital level, made necessary by the multiple insurance companies you have to deal with, all of which have their own guidelines that doctors and hospitals have to follow, the percentage rises to 30%. Almost one out of every $3 that we spend in this country on health care goes to administrative expenses. The average administrative cost of one of our government-run programs, called Medicare, by comparison, is 3%.